So in my day job, when I'm not hosting conferences, I have a company called Freedom Healthworks here out of Indianapolis. What we are is a direct care community. We don't like to use the network word, kind of some PTSD when dealing with physicians when we talk about networks. So we are a direct care community. We are in close to 30 states with nearing on 75, 80 physicians and nurse practitioners that we work with, depending on what state it is. Our origin story, obviously, like I mentioned this morning, is always very personal. Indianapolis was probably the worst city to have a healthcare startup in the entire nation. We have a very unhealthy population of Hoosiers, even though I love them all dearly. But we'll see that a little later this month at the Indy 500. I mean, that is just a show of humanity out there. It's eye-opening. I say that because there are 4 major hospital systems around Indianapolis. So competition for any type of competent physician and medical providers fierce. So it probably wasn't the best place to do it, but Indianapolis is home for us. And we saw a very acute need. But as with anywhere else, hospitals are buying markets. And it kind of breaks my heart, and I kind of laugh when a physician says, well, I sold out to a hospital. I sold my practice to a hospital. I'm like, well, what's that really mean? Did you get a multiple on your profit? Did you get a multiple on your EBITDA? Multiple, what is it? Well, no, I just had a signing bonus. I just signed a contract. Oh, okay. So you closed your office down and you became an employee. How'd that work out for you? Yeah, it's not a good story whatsoever. So despite the headwinds, like I said, Indianapolis is home. We built a thriving direct care community around the city. We're nearing 20 physicians around Indianapolis, and it's been interesting to see the evolution of it from primary care, family medicine, into internal medicine, and now pediatrics are really coming in hot. So here's a quick map. Some of our coming soon practices aren't up there. Orange are all primary care. The blue is actually these gentlemen right here. And then the green are pediatrics offices. So we have a lot of work to do. If anybody's familiar with Indianapolis, it's kind of within that circle right there, the 465 loop. And so we're kind of dotting the map as we go along, kind of an ink blot strategy. So where am I going with this? The competition from hospitals is very, very fierce. But they don't learn anything. You leave one hospital system and you get attracted to another one, and guess what changes? Nothing. So despite 4 different options of employed medicine, doctors are still raising their hand in a very competitive market and saying, I want out. The same boss, the new boss is the exact same as the old boss. And it dawned on us that hospitals view primary care as a source for referrals. We've had conversations with CMOs and hospital administrators that are saying, we'll work with you guys. We'll work with the independent practices, but can we be your dedicated referral source? We said, well, why? Well, so that's the only way we're going to make money off of this thing. We lose money on all our primary care practices. Well, why are you in the business of primary care? Well, we need to control that vertical pipeline of patients. Great. Anecdotally speaking, you talk to an orthopedic surgeon or anybody like that who's been in these systems before, and they say, Chris, 1 out of 3 people that I consulted with, my employer told me that they have to go to surgery whether they need it or not. And that scares the shit out of me as a patient. That is scary because whether you need a new knee or not, that hospital system's bottom line is built on that. And so we always joke about the friendly nonprofit hospital system that is no longer paying taxes, is doing a lot of harm to patients, abusing their workforce. I have a lot of issues with the term burnout. And I'm like, if any other industry besides medicine, those employers would be getting sued left and right for what they're doing to their employees. It's far beyond that. I mention this because there are a lot of physicians out there who are raising their hands and saying, I want out, I want to do this, I want to go this route. And so what we have up on stage here, you've seen enough of me today, this weekend, and we're building this from the primary care side of it. I view healthcare as what I call kind of a linear system. Primary care is the entry point. We're the gatekeepers. people should be calling their primary care physicians when something is wrong. First line of defense right there. That's the entry into the healthcare system. What has been really, really cool in over the past couple of years, getting to know Jeff and Eric up here with WellBridge, is that now we have, if we say we started A over here, now we have Z, what Jeff and I kind of call the bookends. We have built a complete end-to-end solution in an alternate healthcare system within our city. And that is really, really impactful, because for the thousands of people who belong to Freedom Doc practices around Indianapolis, we're able to send them, say, hey, you know what? You don't have to go back into the hospital anymore. We have a great resource for you, WellBridge Surgical right here. And so we built the bookends. And so where the industry is going right now is kind of filling in those pages. We need specialists to start raising their hand. We need people kind of in the middle, that not necessarily invasive surgery, but something beyond primary care. And that's what a lot of the challenges are right now. So having these guys up here, what opened in last November? Last October, last November?
December.
Is something that I see as a way that we can replicate this and start going out to different cities and saying, you know what, we are relocalizing healthcare. That's the biggest thing. What I view is current medicine is built like this. So it's an inverted pyramid. The primary at the bottom is not showing up very well. But when I mentioned, bookends A to Z, primary care is where we spend the least amount of time, least amount of resources, and it goes up from there. Obviously, this is an unstable system. This is not the way of the future. We want to get to something that looks like this. Primary care, that's the entry point. That's where we're spending a lot of time. That's where we're spending a lot of resources. Then we go back up from there. I don't know what that does to their bottom line from a surgery standpoint when I'm trying to squeeze it out there, but I'll let them talk about that. So my point in all of this is that we talk about all the alternative choices in healthcare. This is real. You heard me say that a lot yesterday. This is actually happening. We're putting this into practice. We're putting this into people's lives. We're making an impact by bringing primary care, even pharmacy care, relocalizing it and giving people options to opt out of the hospital system where they're sending dollars out of state to massive systems. They're not returning it back to their communities. And with somebody like WellBridge Surgical, with a Freedom Healthworks network in a city, it's actually a reality. It's not just a dream. So, WellBridge, Jeff, Dr. Eric Inman, thank you for completing the loop and actually making this real.
Right. Well, yeah, Surgery Center Oklahoma, it's been open 25 years now. We've been open just a few months. So similarly, my experience with public speaking is lacking as well. But my name is Eric Inman. This is Jeff Williams. We're two of the three co-founders of WellBridge Surgical, which is, I think one of the talks earlier today mentioned having 1,000 imitators of Surgery Center of Oklahoma. We're one of the first ones of those. So what I wanted to do was to talk to everybody here, kind of just tell them a story about what we are, kind of how we came about, and to be somewhat of an inspiration for others to do the same, and also to talk about the future. And for us to succeed, we know that we need folks like you guys to help implement the change, empower the individual and the buyer to really change healthcare. First of all, I'm an anesthesiologist. And two of the three co-founders are anesthesiologists, Dr. Ron Panicki and myself. Really, our story started in 2017 when another anesthesiologist shared with me a video clip of Dr. Smith talking on one of the news stations. You guys have probably seen some of those, to where he's it kind of blows your mind the first time you see it, talking about how they post their prices. They have surgeons that are involved that do multi-specialty surgeries at their center, and just the transparency and what it's doing to help the buyer. And so we saw that. By that time, I'd been practicing for maybe 7 or 8 years, doing anesthesia. Pretty comfortable doing that. It's a great job, but was looking for something else, and reached out, talked to Dr. Smith on the phone, I believe it was in early 2017, and then we ended up hitting it off great. He is so helpful. He's been so helpful the whole time through. We've been talking to him the last 5 years, obviously, to get going. And I think it was in 2017 in Oklahoma City, we attended our first Free Market Medical Association conference. And right now it's kind of surreal because I remember that conference, and to think that we'd be on stage talking about what we're doing in 5 years is pretty neat. And so, we realized, looking at what Dr. Smith did, we realized that, okay, Dr. Pinicky and myself, we know a lot of surgeons. We've done anesthesia for all these folks. We get along with them really well. We know who's the good ones, who are the bad ones. And so it's pretty enticing to say, hey, can we do this? And then in the last 5 years, it's been kind of a process coming back, talking amongst us. And then we realized that we're anesthesiologists. Historically, physicians are not great business owners. They don't know how to get, as far as being entrepreneurs. Physicians are, and even going through this, I've realized that physicians are extremely risk averse. And so we realized that we needed a business mind, somebody to help us out who's done this before, who's owned a business, knows kind of how to get over those hurdles. And so nobody better than somebody I've known since 4th grade. We've been best friends since Mrs. Hoffman's class in 4th grade. Jeff Williams here. He's a serial entrepreneur that we've, like I said, been friends the whole time, and talked to him about this pretty immediately after we talked with Keith and shared our story. And I want with him and what we thought we could do. And I'm going to hand it off to him to say really why he was motivated to join us and get this thing off the ground.
Thanks, Eric, and definitely an honor to be up here with my best friend since 4th grade. So totally surreal for sure, and of course with Chris as well. So, but going back to what Dr. Keith said in his talk in 2017, I'm a serial entrepreneur. I've had a few startups and still own some of them. And I was just getting killed on Obamacare on my insurance. And so in 2017, my rates went up 18%. And my insurance broker came to me and said, well, I've got some bad news, but there's really nothing we can do about it. It is what it is. You just have to enjoy this 18% increase. And so before 2017, I was covering the premium for all of my employees. Because it was at least manageable, that price. And so after this 18% increase, I had to start passing on some of the premium onto my employees. And I just did not like that. It just didn't seem right to me. And we were, on top of that, we were really a young group. So it didn't really make sense to me because we weren't really utilizing our insurance anyways. So about that same time in 17 was when Eric approached me and said, hey, we've got this idea. What do you think? And I said, yeah, I'm all in. He's like, really? I was like, yeah, somebody's got to do something about this. So, why not us? And so then solidified it in 2018 when my insurance was going to go up by 43%. That is an actual number. I had my somebody at the office confirm that. In order to keep our $2,200 deductible. But if we went to a $5,500 deductible, then they would just pass on a measly 23% increase. So and then at that point I was like, Eric, let's get going faster the better on this thing. Because I knew it was broken and that, again, somebody needed to do something about it. So that's really my story. Is encouraging everyone here as well, just like Eric said, to step out, take a risk, move on your dream, move on to what you're seeing in the market and how you can maybe put a business model together that could be part of the solution. So that's how a random entrepreneur business guy got involved with a surgery center. So
and so I kind of want to flash forward to 2020. Between 2017 and 2020. We were really, like I said, gathering the courage to step off the ledge, jump into the deep end, and say, "Hey, we're going to try this." You guys have all probably seen Field of Dreams. It's kind of, if you build it, they will come, or will they come? And so, over those few years, I had several conversations with Dr. Smith, trying to we were trying to make ourselves basically feel better and be more confident that when we stepped off the ledge that there was going to be something there to catch us. And so we're still figuring that out. But by 2020, I had gotten to the point where we were confident we were going to do this. I had talked to, part of the process of figuring out whether we're going to be able to or not is talking to different surgeons. So working with 3 of the hospital systems and 3 out of the 4 that Chris mentioned in the Indianapolis area, I know most of the surgeons that work on the north side of Indianapolis. And so if you've had surgery around Indianapolis, I pretty much have worked with the surgeon you've had surgery with. And so just talk to the ones that I wanted to be a part of our culture, that I would trust with my family member under the knife. And we talked to the biggest independent ENT group in the city, Otolaryngology Associates. They discussed it on their board level. We're very interested in participating with us. One of the bigger orthopedic groups in town that are also independent, they were interested. And you first talk to these surgeon groups about it and they don't get it. And then the second time, they still don't get it. Third time, they're starting to get it. And so, that's why it takes a little bit of time to, from 2019, 2020, talking to these folks about seeing if they would be willing to participate in the model that we're proposing here in Indianapolis. And so we got to the point where we were confident that we had the surgeons. We got a couple anesthesiologists. We needed we knew a lot of staff, techs, CSTs, OR nurses, pre-op, post-op nurses. Had lots of experience with ones that we knew that would be ripe for the picking to come over to WellBridge. And so what we needed was a facility. And that search for the facility in 2020 was kind of tough at times. I'll have Jeff talk about looking for the facility. That took a few months.
Yeah, you need to be optimistic and opportunistic as well. And so, when COVID hit, for me, I just thought through it as, hey, I smell opportunity here, right? And so we were probably the only people looking at commercial real estate in April and May of 2020, for sure. And so my commercial realtor had nothing else to do other than help us find a facility. So we were able to be really opportunistic and be able to take advantage of the market, where, as you probably remember on the news, they were saying nobody will ever return to an office. I've been through some of these business cycles before, so I knew, that won't be necessarily, it's going to change, but not necessarily true forever. And so our previous hurdle was trying to find real estate that was cost effective. And so COVID actually helped us out on that journey. And so we found a building that we really liked on the 465 loop, as Chris's map showed. We're like right there. You cannot miss us. So our building is like a billboard. It's great for sales and marketing guy like me. And so the price was still a little bit higher than we wanted to on our budget. And so the lady who owned it was very gracious. We talked to her about, what we're trying to do at WellBridge, and that we're trying to lower healthcare costs in Indianapolis, put money back into the pockets of fellow Hoosiers and self-funded businesses to be able to grow their business more. And she came down to a very, very reasonable price. And that's basically how we ended up with our building that we're in today. So we're very opportunistic, and it's worked out great. Dr. Panicki was, since he's not here today, we give him all the credit for the build out. So it was an existing building. We gutted it. It was about 18,900 square feet-ish, somewhere like that, something on that line. And we remodeled it into 4 ORs. So that's kind of the story on the facility.
And so in last September, we started with 3 employees. We had a tech, we had a OR nurse, and we had a recovery nurse. And so started out, did our first procedure on December 2nd. It was a guy with a tennis elbow. Needed a tennis elbow repaired, and we did it for probably 40% of what it would have cost at the other surgery center that the physician goes to, that the surgeon goes to. So as I remember, I think he's a small business owner. It was just self-pay, out of pocket. Him and his wife owned their business, and they just wrote us a check for it. So that day was pretty cool. We went out and celebrated. We can get lost in this really, and I'm always really lost in it. The whole process of, it's always kind of the next step. What are we going to do next? So we're trying to celebrate the small victories, but that was a pretty cool day to have provided somebody with superior surgical care, and they just wrote us a check for it, and it worked out great. So kind of flash forward to now, which is just 5 months later, we've got 10 employees, and we've done procedures in urology, GYN, like I said, ortho, ENT, GI. I don't know if I said general surgery, but most all the outpatient procedures, other than ophthalmology, we haven't done any of that yet. But we've got great independent surgical groups that are working with us, and we're apparently on our way.
Yeah, funny story now, not back then, but on that first surgery, our receptionist quit the day before after only being with us for 1 day. So the Great Resignation, as you know, is a real thing. And so I got the distinct privilege of running the front desk for a few weeks. And so why not? We're entrepreneurs, right? Now we do anything and everything we need to keep the business rolling. Actually, I rolled up closer to our grand opening, and Eric was out in the parking lot with his scrubs on, with his leaf blower on his back, blowing the leaves off of the parking lot. That was one of my prouder moments. I was like, he's made it to being an entrepreneur right there. That says it. And I went inside.
You got to understand all the jobs. From
right,
top
got to
to
understand
bottom,
all the jobs.
You got to know everything.
I walked inside, and it was our grand opening, and I go, Ron, where are you at, Dr. Panicki? And he's like, I'm back in the bathroom trying to figure out how to load this paper towel dispenser. It's like, this is amazing. We've made it. But anyways, that was a business owner. So for that day when I was at the receptionist desk, I got the chance to talk to his wife, and it was just such a fun moment because our business model was becoming a reality, because she was just so grateful for us that we were there, and that they knew what they were going to have to pay. And she didn't even really know how much the savings was, because the hospitals will never tell you a bundled rate in Indianapolis. And but I mean, the number that she threw out was it was a minimum of $4,000 to $5,000 savings for her and her husband and their business. And that's a big deal when you're a business owner and you're down in the trenches every day, and you got a lot of curveballs being thrown your way, to be able to save that money. So, but my job at WellBridge is mainly to be the networker, to be the one going out and talking to the self-funded businesses, to meeting guys like Chris that have the DPC docs, all the different avenues that the hospital systems obviously have, that I've heard talked about throughout the conferences. They have those primary care folks that are sending them the referrals, and they just kind of have that natural pipeline. Well, we don't have that at WellBridge. So my job is to get out, spread the news through marketing, which would be through our website and PR and pieces like that, in order to meet an individual wherever they're at on their healthcare journey, but also sales. And so I divvy those up into two different buckets. And so for sales, it's out literally going and calling on the benefits advisors and brokers, trying to figure out which ones actually want to play ball, which is not very many, but there are some good ones out there. And then figuring out the ones that don't want to play ball, and then doing presentations in front of self-funded businesses. So 70%, I've heard as high as 80%, but 70% of Indiana is self-funded. And as you know from the RAND study, we have some of the highest surgery rates in the nation. So for a sales guy like me, it's pretty fun to get out there and let the CFOs, I'm mainly calling on CFOs of these self-funded businesses, to let them know that they now have a choice. And not only for our side on the outpatient surgical side, but also, from primary care, imaging, all these different, what Chris and I, like Chris said earlier, the bookends of the new healthcare ecosystem, and help guide them into a better path. And so a lot of folks have been catching me and asking me like, well, what does that look like? So who are you calling on the CFOs? Once you talk to them, what does that look like? And so, like Eric said, we're just getting started. So I'm running into new walls and hurdles every day. But mainly it's talking about the plan development of their plans and get for them, the self-funded companies, to get some sort of taste of what kind of navigation they want to be involved with. So what I'm seeing best practice out there is putting us in tier 1, meaning there's some sort of component where they're waiving the deductible if the patient ends up picking WellBridge Surgical, or actually paying them cash in order to help them make a good decision and head to WellBridge Surgical as well. Some of the other pieces that I'm hearing from employers is the Great Resignation, for sure. And so they're scared to mandate anything within their plans and still totally leave it up to the employee in making that decision. And so, but I do have one, and I haven't asked permission to use their name, but so I won't. But a very big business in Indianapolis that was just in for a tour, and they're actually going to mandate within their plan for their employees to come to WellBridge for the outpatient surgery. So that is an option as well when you're working these different avenues of navigation. It just depends on what the employer's appetite is, basically. So that's my part of WellBridge and what I'm doing out on the street.
And kind of like I said before, so I'm a marathon runner, and if any of you guys have run marathons, you know what it is. In miles 2 through 4, you're just kind of gearing up. You're just kind of getting in the groove. You're starting. You've got a long road ahead of you, and I kind of feel like that's where we are now. We're just kind of this is our first chapter that we've shared with you. And so we hope there's many, many more chapters to write in a long book. And you guys, are the people who are going to be characters in that book. You're going to help us write that book. Like Jeff said, what we have is we have great surgeons. We have a great staff there. We have an awesome facility. And we've got employers who are looking to utilize us. We've got people who are self-pay, cash payers looking to utilize us. What we have to do is figure out how to implement the plans, figure out how to get those patients to us. Really figure out how to get the word out that there is, like Chris said, this is a real thing. This is happening. It's happening in Indiana, and now you have a choice. People are so brainwashed that they just are so used to being shepherded around from their PCP that they probably know to a surgeon that they don't know, to go to have surgery at a place that they certainly don't know about. They don't have any idea how much the cost is or the quality. And so we're just trying to get that word out there. And like Jeff said, we're working with the plans, figuring out how to do that. Just had a conversation with Matt Ort. I think he's in one of the other rooms right now, but talking to folks here about who can kind of help bring the buyer and the seller together. So we've built it. We're just and we're doing procedures. We're just waiting for the volume to come and to figure all that out. We definitely wanted to leave some time open for questions, to have a discussion back and forth, to really answer anything that you guys have to throw at us. We're just learning, so if it sounds sometimes like we don't know what we're doing, there's a reason for that. But we've jumped off into the deep end, and I think everybody here at WellBridge is very happy about where we are right now.
Well, I'm going to kick off the questioning here. It's like, no matter how many practices that we're able to spool up and how many independent physicians move into the primary care space, we've never had an acting U.S. senator come do a tour. How did you manage that? And why is there just so much more excitement over surgery centers than there is primary care offices? It just never made any sense to me.
Yeah, you can talk about Senator Braun.
Senator Braun, if you're familiar with him, is a big advocate for healthcare reform. And I think if it wasn't for COVID, he had some legislation that he was trying to get passed. So I think he heard about us through another doctor. I'm blanking on her name right now. That Dr. Panicki.
Mercy Hilton?
Mercy, yeah. Mercy had mentioned our name, and so he came out, and that was a great day for sure to have him come out and visit, and just a breath of fresh air because of his business experience as well. We have similar paths, except his business is way bigger than ours. But
and he's a senator.
Yeah, and he's a senator, and pretty much I have nothing in common with him. But but yeah, that he grew his business to, I think, 1,800 employees all across the country, and is a believer in what we're doing, and asked us what we need from the federal level in order to help us. That was huge. Congresswoman Sparks is also, which obviously Chris also knows, and has come in as well. At the end of the day, I think it's folks like all of us who want to make a difference, and it's entrepreneurs that are going to make the change, not the government. But it's always good to have Congresswoman Sparks and Senator Braun, obviously, to have their ear. But it's really up to us to dig in and make it actually happen.
And I know you're asking about surgery versus primary care. I guess the only two things I could come up with is that, being an anesthesiologist, I get, when you're out, I get questions about, what happens in the OR. I just think it's kind of fascinating for people. People get fascinated by that sort of thing. And also it costs a lot more than primary care.
Because we started in Indy back in 2016. And when we're starting this, we're saying, wow, we have this new concept, this novel way of doing medicine, or doing the business of medicine, and allowing physicians to go use all their experience, and this is, it's their calling. When you guys came in from a surgery standpoint, there was so much buzz and excitement around the city and the region that it completely changed the game. It absolutely did, and if anybody's on the primary care side or familiar with that, without having that kind of an anchor at the end of it, I think you live it where people are saying, oh, this is nice. This is kind of a cute way. It's kind of a boutique. But then you put it in a surgery center like you guys have done, and it's like, oh, this is actually a thing. Now I can answer that what if scenario, because everybody wants to go to the what if scenario. What if I get sick? What if I get hit by a car? What if I need surgery? What happens then? The primary care can't take care of it. We're like, well, great. You go talk to these WellBridge guys. You can go visit them. They're great people. We've known them for a while. And it has lent so much credibility and just cemented, not just in Indy, but elsewhere these things are popping up. It cemented that, again, we're not just full of bluster. This is actually happening, and this is actually an option for people. And to get the attention of politicians, whether that's a good or bad thing, debate's still open in a lot of places for that, but businesses can say, oh, okay, this isn't just some smoke and mirrors thing. So it's lent a lot of credibility to what we're doing on the Freedom Healthworks side, to have you guys up and going. And that's why I'm pushing you, saying, all right, where's the second one going in? Where are we going with WellBridge too?
Somewhere warm.
So one question there.
Is it a purely cash-based model, a transparent pricing model? Is there any insurance involved? And how did you decide on whether or not to be hybrid versus home?
Yeah. So what we decided was not necessarily who could pay or couldn't pay. It's really who. So what we wanted to do is similar to what Keith did with Surgery Center Oklahoma. Everybody pays the same price. There's no discounts. If you're talking about discounts and needing a falsely high charge master and need a discount on that to show your clients or your members, that's not part of what we do. And so everybody gets the same price. The price on the website is to somebody who doesn't have insurance versus anybody who would have insurance if it's a patient who is part of a network. And so very early on, we went and we were introduced to some folks at United Healthcare, and they seemed surprising to us, seemed interested in being part of this and having us part of their network. So as of March 1st of this year, we're part of their network at just at our prices. And so they're members. So in that instance, the only real difference is, so if you had Anthem and you have a high deductible, it would not count towards your deductible. With United, it does count towards your deductible. And they've worked with us in creating an easier way to get claims paid and get claims paid more efficiently. And so it's not necessarily just cash. It would be that, as well as like similar to Surgery Center Oklahoma. If it's a self-funded employer, it's just basically an invoice. So net 30, so pay within 30 days. The price individual upfront is upfront.
Yeah, so no matter if it's United or just someone walking off the street, it's the same price. And so I have folks trying to wrangle us all day, like every week for sure, maybe not every day, but trying to figure out how they can get a cut, of this. Like, hey, we're going to bring you folks, but we need you to pay us this, or we need this percentage fee for our marketplace, or whatever it is. And so we've held the line that it's the same price for everyone, and that we're not, paying any percentages or anything like that. We're just keeping the game simple and as simple as possible, and no matter who you are, basically. Does that help answer your question? I can't actually see you or anybody on this side of the room, actually.
It is much of an advantage of people in the front because I can see their hands.
Yeah.
My name is Maria Pacena. I'm the Chief Surgical Sherpa, and we've been running for the last 3 years our own direct surgical care community for Latinos. And so I have a question for each and one of you. I wanted to start with you, Eric. As far as the implants, do you have a relationship with vendors, and do you pass the cost? I mean, is it at cost to your patients? What does it look like? And then for you, Jeff, to start out meeting employers, you said that you only have seconds to talk to get your message across. Other than you have a choice, I would love to hear what else do you say to connect so that they want to continue a conversation.
Yeah, so with the implants, that's also a pretty easy answer. We try to keep everything very simple. So with the implants, and this is also with guidance from Dr. Smith. So if a total shoulder implant costs, say $5,000, that just gets added. It's $5,000 more than our cost. So we just pass it on at cost. It's just a pass through for us. And with the relationships with the vendors, we have found, surprisingly, because we were warned about this going into it, that the vendor costs, the implant costs are going to be so high, the hospitals pay such a high amount. I mean, we signed non-disclosures with all the vendors that we talked to about different implants. Cochlear implants are extremely expensive, and total joint implants, but they are more receptive to what we're doing, and they've dealt with cash pay patients before on an individual basis, and we're just basically aggregating the cash pay patients together, and they do take that into account, and in my estimation, we get a better price than the big hospital systems that the vendors know that they're just going to add 20% on top of it. It's just like you'd rather get, it's just kind of like the medical loss ratio. It's an advantage for the people in that situation to charge more. In our situation, it's totally different, and they understand that, which is refreshing.
Yeah, my target audience, like I mentioned, was the CFO. So my messaging depends on who I'm talking with. So if I'm talking to a CFO, I'm talking about dollars all day long. So our average cost savings is 50%, and we've put that data together, like some of the talks yesterday with some local TPAs. And so we know those numbers are true. So that's what I'm talking about first with a CFO. Then I'm moving on to quality second with a CFO. If I'm talking to HR or benefits, then I'm starting with quality and then working my way to cost. Because just based on when we got going on this, the first questions that are coming out. So I just kind of tailored it that way. Yeah, we're reaching out to the Latino community too. Dr. Pinicki's wife is Peruvian, so we've had her on the radio and TV, Telemundo, So yeah.
Maybe
Anyways.
we'll get some Latina Sherpas.
Let's do it. Yeah.
We got time for one more.
I see.
Yeah,
Yeah,
Dr.
go ahead.
Kendrick. Yeah.
The patients that you've had through the clinic, through this center so far, where did they come from? How
So,
did they get to you?
Yeah. So there's been a smattering. We have. I got a shout. I feel like I should give a shout out to Shauna Thomas with Host Care Resources. I think she's right over there. They've sent. They're based out of Northern Indiana, and they've sent a fair amount of patients to us. Also, the direct primary care docs, the DPCs, they've sent a good amount of patients to us. Through word of mouth, and we've had some direct relationships with some of them. But then we'll get calls from some that we haven't talked to before, and they have that's a kind of a tight knit community, and they talk amongst each other, and say, hey, where can I send this patient who's cash pay? That's been good.
The Christian Ministries, so MediShare, Samaritans, Christian Health Shares, all those different ones have been sending us patients as well. So it's always good, right, to know where the patients are coming from. So when they call in, Eric needs to make sure he's making a note for me on where my marketing and sales are working. So
Tracking lead sources.
Among my other duties in the OR and outside of the OR, I'm basically the referral guy too. Now we have one of those 10 employees I said we have now. We've hired one that does some of that too. But yeah. That's actually a part that I really, really enjoy is being able to talk to the patient. They called in off the website or they come from a DPC. I talk with them through what their procedure is, who I think the best surgeon for them is, and then get the labs, results, imaging in order for the procedure to happen. They get it scheduled, and I actually do the anesthesia, which happened with our first patient on December 2nd, that tennis elbow. It's really, really neat to be able to do that. It's great.
So Jeff, are you still running the reception desk and you're still leaf blowing?
I love leaf blowing, but maybe this fall again.
I did not love running the front desk, so we've rehired that position, thank God. So Stephanie is my best friend.
That's great. Well, thank you so much. We'll be available. We got a quick networking break here, but thank you.
Thanks.